theirs to really understand veterans, our customers' needs, co-design with them, and deliver the best possible experience for veterans and their families. Well, before we get too much into human-centered design, I wanted to give you some background on why we believe that innovation and using principles like human-centered design are important. So if you look on the screen, you can see that in 1896 and in 2017, there was only one company that was on the Dow Jones Industrial Average Index Component list in both years. And that's the General Electric Company, or GE, as we more call it in our everyday language. And this is a great example of why you need to innovate and transform and modernize as an organization. Companies and organizations, nonprofits that don't innovate or don't take time to listen to the needs of their customers often aren't there in the future. And it's because everything is changing so fast in our current technological state. And also customers are having increasingly new expectations based on where they're at in other delivery of services that they're receiving in their daily lives. So we at the VA believe it's so important for us to modernize and transform. After all, our veterans are now using apps like Uber and Lyft. They're doing all their banking online. So why shouldn't healthcare and their benefits experience evolve with that? So we at the VA believe in innovation very strongly so that we can modernize, evolve, and change to best meet our customers' needs, who happen to be veterans and their families. Now, our customers are veterans, but we hope that you can apply this to your organizations as well. And a lot of what we've done here at the VA to help build a culture of innovation can be traced to something called the VA Innovators Network. And our goal with the VA Innovators Network is to create a safe space for VA employees to test new ideas, develop those ideas in collaboration with the veteran community. And what we've done is we've co-designed with our employee this program that currently exists at 22 sites in this fiscal year, and is actually growing to 11 more sites in the next fiscal year. So we'll be at 33 VA medical centers across the United States. And our goal with these sites is to really help empower and engage employees at the front lines of VA so that they can see and solve problems on the ground to best serve veterans and their families. And one of the main methodologies we use at our VA Innovators Network sites is something called human-centered design. Human-centered design, or sometimes called user-centered design, is all about a process, a systematic way for problem solving that is hyper-focused on human needs first. And it's all about working with your customers, listening to and understanding their needs, and then based on those needs, co-designing with them new experiences. And this is a very creative and iterative approach because it's all about getting pen on paper in collaboration with your customers to really find new approaches, new solutions that meet their needs first. This work first started at the VA about 4 years ago. VA, if you all remember in the media, was in crisis mode. We frankly weren't doing as good of a job as we could to serve veterans and their families. So we decided we needed to take a new approach. Rather than often assuming what we thought our customers needed, we went out to our customers, veterans and their families, to hear about their experience. And this kicked off a human-centered design effort at the VA that has now expanded to a number of different programs. If you're looking to learn more about this work and how we got started, if you're looking to start a similar initiative in your organization or your group, check out innovation.va.gov, and you can find our past reports and examples of how we got started in this human-centered design journey. So to introduce you a little bit more to the concept of human-centered design, I first want to tell you a story about a potato. Well, in fact, it's not about a potato, but it's about a serial entrepreneur. A serial entrepreneur one day was watching his wife peel potatoes. Unfortunately, she has arthritis, so it's really hard for her to use potato peelers and other apparatuses with her hands. And they had one of those old wiry metal potato peelers where oftentimes their hand slips, it's hard to grip. And this entrepreneur was watching his wife struggle through this experience, and he thought there's got to be a better way. So what he did is he went out to his garage, and if you look at the first peeler that you see on the left, he got a bike handle off an old bike, and he stuck it on the end of that potato peeler. And he then gave it to his wife and then watched her use it. And in that process, he observed that while that worked significantly better, and he also asked her opinion as well, her hand was still slipping from that grip. So then he went back out, got a new bike handle, and he stuck it on the end of the potato peeler and watched her use it again and asked her feedback on it. And the grip was significantly better. So this set the serial entrepreneur on this journey of how can we really design a better potato peeler. And they iterated through a bunch of different prototypes, being the entrepreneur that he is, and ultimately he landed on the potato peeler all the way on the right. And what you see with that potato peeler, I'm sure many of you recognize it, it's from the now pretty well-known company Octo, and it's their product line called Good Grip. And Good Grips has now been extended to dozens of products. I'm sure many of us have these products in our kitchen, in our homes, whether it be potato peelers, strainers, measuring cups, and beyond. And the story of this potato peeler is one of human-centered design. It's all about listening or observing your customers' needs in their current state, and then trying out and co-designing new approaches that best meet their needs. And while human-centered design is an incredibly powerful methodology for you to use in your organizations, and it can get boiled down to two reasons. First, it allows you to increase adoption of whatever you're developing. And so time and time again, human-centered design studies have shown that because you've actually co-designed with your customers' needs in mind, not surprisingly, you actually get higher adoption or usage of whatever new system, program, pathway, or process you're building. Secondly, because you co-design with users' needs in mind and you're getting higher adoption, there's less rework. Oftentimes in many organizations, people assume what customers need, and this results in a lot of failures. And it also results in a lot of projects having to go back from the drawing board or go back to the drawing board and start from the beginning and really listen to our customers' needs. So human-centered design work has shown many times over that it reduces rework, so it ends up being better for your bottom line as well. So what I'm trying to tell you is human-centered design allows you to design higher adopted programs, processes, technologies, and you also can end up doing it for less money and time because you get lower rework and higher adoption. All right. What we really focus on with the human-centered design process at the VA is we can boil it down to four main phases. After all, a lot of what we're trying to do at the VA is trying to engage and empower busy frontline providers. And so to do that, we try to really boil it down into four main phases or steps that they can use to help develop new approaches, new services, new technologies for their customers, veterans, and their families. And grounding everything we do in the need to really surround everything in what people's unmet needs and desires are. The four main phases are, first, the frame phase, which is all about scoping and setting the challenge statement for the problem you're going to solve. The second phase is the discover phase, which is all about going out and listening to customers' needs and really developing insights based on what you heard from your customers. The third phase is the design phase. Based on the insights that you learn in the discover phase, you co-design new pathways, new processes, new organizations, new processes based on those insights. And then the fourth and final phase is the deliver phase, which is all about taking what you've designed or prototyped in the last phase and then implementing it and hopefully scaling it and sustaining it if it's successful. So before we go deep dive into each of these phases and the different tools and methodologies you can use as part of them, I want to share an example from a project that we did at the VA a couple years ago where we used human-centered design. This work was led by Dr. Kate Havens, who was the Director of Women's Health at the Milwaukee VA. And one of the issues that they were facing is how to improve their HIV screening rates. So you see, and as you all probably know here on the line, in the 80s, HIV and AIDS was a new disease on the scene, and it was devastating. It was impacting many hundreds of thousands of people across the world, and there really was no great treatment to help folks that were affected with this disease. The good news is in the 90s, there was medications that came onto the scene, but they were large cocktails of medications that were really disruptive to one's life. The even better news is now in present day, the HIV virus can be really solved by taking one pill. So this is a great story of technological innovation and the trajectory of how disease states can change over time with that innovation. So now patients that get treated with HIV can, and even if they're affected as a baby, can live as long as folks that smoke a pack a day, and they can live long, healthy lives. So the question the VA was asking was, despite having this great transformative medication, why were HIV screening rates so low? At the VA, we were actually doing a really good job with screening for other chronic diseases like diabetes and cholesterol with rates over 90%. But we found in a national study and local studies that only 20% of veterans were getting screened with HIV. And in particular, Dr. Kate Havens was seeing that these screening rates were oftentimes even lower for the woman veteran population. So she thought there's got to be a better way. And this was the frame phase, the scoping and understanding the problem to solve. So what she did, she assembled an all-star team, a very diverse team of folks representing the Patient-Centered Care Aligned team, or PAC team, at the Milwaukee VA. And this was a diverse team of physicians, nurses, and other providers from Women's Health. They also had infection and quality control nurses join the team, community AIDS advocates, and last but certainly not least, 2 design students from the Institute of Design that helped support this work. And they set on this journey as part of the discover phase, the next phase of the human-centered design process, to ask why. You know, why weren't we screening HIV? Why weren't we screening our patients with HIV, even though we had a great solution to help support them? And this was the discover phase, and you go and interview different stakeholders to hear about their current experience. So one thing they learned in this phase, they started interviewing veterans, and when they heard from veterans that, yeah, they wouldn't mind being screened by HIV, but didn't have a good understanding of why they weren't being asked, they decided to go to the providers. And in particular, when they were interviewing the physician community, they heard in their human-centered design interviews that oftentimes the physicians were dreading this uncomfortable conversation. After all, their appointment times were getting shorter and shorter, and they had less time to really talk one-on-one with their patients. So when it came to things that would slip or roll up the list of questions, HIV screening became one of them. And this is not because they're bad providers or because they were reckless, but just that these oftentimes were physicians that were trained in the 80s. The average age of physicians at the VA in Milwaukee was the late 50s. These were all the same physicians that were residents in the 80s, that if you think back to my very first slide, really didn't have a great solution at the time. And so when this all comes to light in the human-centered design qualitative interviewing process. So it turns out they really were dreading this uncomfortable question of asking if they wanted to be screened for HIV. And they had little experience in this because they were all trained in the 80s and really hadn't been thinking about this in their day-to-day appointments. So the other thing that they found difficult too is that it's really hard to identify who's at risk. And oftentimes as a provider, you're going through your checklist in your head of, oh, it's this and not that, based on what we're seeing in some of their tests or what they're telling me. and it's really hard to tell who's at risk with this pretty devastating disease. So all of these factors contributed together to HIV screening rates at the VA at around 20%. And so they then entered the design phase, and they started co-designing with veterans, with providers throughout their care teams. And what they realized in this process that LPNs weren't being leveraged and worked with to their highest level of licensure. And so what they did during the design phase is they came up with a first draft, or what we sometimes like to call in the design community a prototype, of what this new pathway could look like. And they had LPNs ask as part of their appointment timeframe, would you like the test? They developed buttons, and they had developed a whole campaign surrounding this. And they formed this all-star team, and after piloting it for 3 months, they saw huge increases in HIV screening rates from 20% up to 90%, which is on par with the rest of our chronic disease screening at the VA. And a huge part of this was forming this diverse all-star team and bringing them together from multiple disciplines to develop a better pathway for veterans and their families. And this now takes us to the final phase called the deliver phase, which is all about implementing and scaling what's worked. After pilot testing it for 3 months and getting feedback from the users, they then had a solid plan of what this looked together. They packaged it up and began really trying to scale it across the VA. And if you'd like to learn more, you can check out their website, hiv.va.gov. And this was the deliver phase. So hopefully this gives you a quick example of how human-centered design can be used, not for some whiz-bang new type of technology, but for a really important pathway and process as part of healthcare in the U.S. So now I'm going to switch gears a little bit. A huge part of the human-centered design mindset is, a huge part of the human-centered design process, rather, is having different mindsets than you normally tackle problems. One of the opportunities at the VA that we were trying to combat is that oftentimes our VA employees were told no a lot. I think that's a good idea, but no, that'll never work. Or just flat out being told no. And so a big part of what we do at the VA and our Innovators Network is try to teach folks new mindsets to approach problem solving. So first is to be open-minded. There's a lot of complex problems that we're facing at the VA. And if we keep on having this no response to everything, we're never going to evolve and modernize. And Einstein has this famous quote, we cannot solve our problems with the same thinking we used when we created them. And this is why human-centered design is really important. Next is to be collaborative. It's really important to, again, not try to solve the problems, not with the same mindset, but with the same people that developed in the first place. Making sure you're reaching out to different domain areas, different levels, different age groups, and really learn from each other, challenge each other, and disagree with each other as part of this process. Because that's what's going to help you develop the best possible experiences for your customers. The next is to be adaptive. The human-centered design process is all about moving forward through uncertainty and being uncomfortable and not knowing what's going to happen next. Because you're really just trying to listen to your customers' needs, co-designing with them, and seeing where that takes you, and not trying to be too prescriptive up front and making too many biases up front. So it's really important in the human-centered design process to be adaptive and to iterate and evolve, much like how we saw in the potato peel example earlier. Other key parts of the human-centered design mindset borrow from improv comedy. So if you've ever been to an improv show, if you shout something out to them as part of one of their skits, you will rarely, if ever, hear them say no, which is quite different than the culture we were facing at the VA. They're very big in improv on the phrase yes and. So to give you an example of this, instead of if you approach one of your coworkers and say, hey, I have this great idea to improve the HIV screening pathway. Oftentimes the VA would hear someone say, no, that'll never happen, or yes, but have you really thought of X, Y, Z? So one thing we're trying to teach folks at the VA, even though it's not just nomenclature, it's a mindset, is this notion of yes, and have you thought of this, or yes, and have you considered this? A second thing is to defer in judgment. is ensuring that you're not judging ideas too quickly before they've had time to really evolve and transform based on customers' needs. Also knowing that there is no right answer for tackling a problem, and you need to really focus on your customers' needs and listening to them. Diversity is good, which we've talked a lot about. And the notion that working visually when possible is a huge plus. We have different types of learners, and being able to draw and sketch out also helps things maybe clear and crisper. To embrace the ambiguity, because human-centered design is all about listening and evolving based on those needs, so you don't really ever know where you're going. And last but not least, to have fun. So now what we're going to do is go through in a little bit more detail each of those 4 human-centered design phases. So first, starting with the frame phase, which is all about scoping the problem to solve. So you can see here on the screen a picture from the Ebola crisis response in Liberia. And the example I want to share with you here is something that USAID was trying to tackle during the Ebola crisis. You see, they were facing a huge problem with the protective equipment that you see get highlighted in this visual right here. The problem with a lot of the protective equipment that healthcare workers were using is that it was really uncomfortable. If you remember, this was happening during extreme heat conditions, and it was really hard for them to take a drink of water, even though they'd be working for hours on end. So what happened, but with a lot of these protective equipment issues, where then clinical workers would then come down with the virus themselves, is they would put down their mask for a minute or a few seconds, not realizing it, and then they'd come down with the Ebola virus. And so the USAID and healthcare workers across the world wanted to come together to solve this problem. And they put out a huge challenge in collaboration with a design firm known as IDEO. And they appropriately scoped the problem based on using visuals like this to show the issue that the protective equipment was facing and the users of it were facing. And that's what the problem phasing phase is all about. Taking a second to understand the scope of the problem and working with the users to demonstrate that before kickstarting the project. And this is often a change in pace into how we normally tackle projects. It's all about focusing on the problem to solve, not on proposing a solution. I'm an engineer, and as engineers, we're famous for this. We dive to a solution before really understanding the problem to solve and understanding the root of the problem to solve. And that's what the next phase, the discover phase, helps with. So before you get there, it's all about trying to outline the first pass of the problem to solve. That way you kickstart the rest of the project at a good pace and aren't diving to a solution and solving for the wrong problem. As part of the frame phase, one common question, or what we like to call statement starter, you'll hear designers and innovators use is a statement called how might we. And if you break it down, and this is from Tim Brown of IDEO, that design firm I mentioned earlier, it's all about how, that there are solutions out there, we can put ideas out, we do it together. And it really creates a more positive environment for framing and kickstarting your project. Another example of how one team started the frame phase that led into discover and then design is from a team at GE in Wisconsin. So this team was facing a problem that, in particular, little children going through this machine, which I'm sure you all recognize on the screen, were oftentimes really scared. And because they were scared, they wouldn't go into the machine, or they had to be anesthetized. And as we all know, if you can avoid being anesthetized, that's a positive thing for little kids. And so what they did is they worked with a team of designers, and the team of designers framed this problem of how might we improve the experience going through the machines to reduce anesthetized levels of children and to create a better experience overall. So what they did is they then went out and observed kids where kids like to be on a playground and museums and having fun. And one thing they saw time and time again is that they saw that kids love to play pretend. So what they did is they take the same equipment and they put it stickers, and they created a much more positive experience for the kids. And what they did is when the child arrived on site, they allowed them to dress up, maybe like a pirate, maybe like a fish, and they put them in a little cart and they wheeled them down to the room. And they told them that they're going on an adventure under the sea or in a pirate ship. And they took the anesthetized levels from around 30% down to the low single digits, all with just some paint and stickers. Rumor has it that they also wafted the smell of margaritas through the space as well to help calm down the parents as well, because we all know this can be a pretty stressful experience for the parents too. So this is just another example of how the team took the time to frame the problem correctly. In other methodologies, what you might see happen is they would develop different patient education materials, maybe a video, maybe a checklist that they would have emailed to the patient beforehand to help prepare the parent and child. But with this example, they took a really human-centered design approach to really understand what the needs were of the customers and to deliver and develop the most positive experience possible using a very creative strategy. So this now takes us into the second phase, the discover phase. And this is all about approaching data, whether it's qualitative or quantitative data, with curiosity and openness to really build empathy and learn from different stakeholders who might be your potential users. And there's two main methodologies that we really use as part of this discover phase. One is contextual research. So what do we already know? What information is already out there? We definitely don't want to reinvent the wheel, but seeing what already exists out there. And the second type of research you see oftentimes happen in the discover phase is ethnographic research. So pretending you're a safari guide out there, an ethnographer, and taking time to really maybe interview your customers one-on-one. Also doing contextual inquiry, so meeting them where they are and asking them questions about what they're doing just in the moment. Taking time to observe or watch them in practice. Or the last one, which is one of my favorite, is walk a mile. Literally putting yourself in their shoes to see what their experience looks like. And in the discover phase, you can collect quantitative data or qualitative data. So quantitative data might be from some other data points or other collection methods you already have at your organization. Qualitative data deals more with descriptive information and is oftentimes observed or heard in an interview. And why you need both quantitative and qualitative data, I think, can be summarized nicely by the famous anthropologist Margaret Mead. What people say and what people do and what they say they do are entirely different things. And so during the discover phase, it's all about going out there and observing and listening and finding the data to really help you better understand what the current state looks like. And I think another way this can be summarized is on Facebook these days, a great article in the New York Times showed this, is that what people show on Facebook might not be reality. So this is why you need this blend of quantitative and qualitative data collection methods to truly understand the current state. So this leads to the third phase, the design phase. And the design phase is all about, based on the information and data you collect in the discover phase, coming up with a series of insights that you can then take back to your customers, maybe the same folks you interviewed or observed in the discover phase, and really brainstorming with them, ideating with them, and coming up with first drafts of new concepts. Maybe you're drawing out what a new reimagined journey would look like, or you're doing something called paper prototyping, where you're drawing out what that new technology, that new organization, that new solution or process looks like. And the next thing we do is this concept called prototyping, which is all about trying to build the minimum viable product, sometimes called the MVP or first draft of what you're trying to do, and then testing with your users. Oftentimes at the VA, what we were doing is taking way too much time and money to build a more robust first draft than we actually needed. What we really needed is the lowest fidelity first draft possible. Maybe it's paper, maybe it's cardboard, maybe it's a sketch, and bring this to our users and getting feedback before dedicating way too much resources on something that doesn't work. Based on feedback from your customers or users, as you then can then iterate on the design and continue with that process until you have an idea that's pretty well baked and feel comfortable with based on user feedback. And this brings us to the final phase, the deliver phase. And this is all about finalizing the concept you developed and really making plans to implement it to bring it to life. It's really important in the deliver phase to tell the story of how you got here, because this helps gain adoption and buy-in, maybe from senior leaders or folks that might be naysayers, because they believe in the process. So you work with your stakeholders and viewers throughout the process to help design something that works for them. Also, this is also when you want to think about how to define a return on investment, really outlining what value your innovation or new product, service, technology, or product brings to bear for your customers. And oftentimes you want to think about how to sustain this. At the VA, because we're the nation's largest healthcare system, we're very focused on how do we export innovation to other VAs. And this is something that I'm sure is similar in your organizations as well. And in summary, it's all about trying to outline the valued impact that this will have and capturing that over time as it continues to scale. If you're looking to learn more about the human-centered design process, we have a much more robust version of this presentation in a toolkit that we put together that's on the website that you can see on the screen. Also, if you'd like to hear more stories of human-centered design projects at the VA, we'd be more than happy to share it with you. So feel free to email me with any questions or call me at the number, and I'll type in my email address in the chat box here, and happy to answer those if you have any questions. Thanks so much for your time, and we hope you have a good rest of your day.